Good afternoon. We're here with Humboldt County Public Health Officer Dr. Teresa Frankovich with the August 5th media availability. Thank you for being here with us.
Thank you.
Is there anything you'd like to mention before we get started?
Well, I was just going to note that the state did come out with a guidance for youth sports. We've been waiting for that, and it did finally come out. It's just a couple pages, and so it's fairly brief. Our Joint Information Center will have that available soon on our site so that people can actually, look at the guidance, develop a plan, and submit that to us if for review in the JIC. I think that there are a few points on the guidance that are quite clear. One is that strength and conditioning is allowed, but it should be done outdoors, and it must be distanced, meaning you need that 6 feet between kids, and in cohorts, meaning that you keep a consistent group of kids together doing that activity over time. The smaller the group, the less the risk. The second point is that only sports that allow for 6 feet of distancing at all times can occur. And so I would think some sports lend themselves to that pretty easily. For instance, track. You can probably do that sort of distancing. Golf, singles tennis. Obviously, there are other sports in which it's just not possible. Football, basketball come to mind right off the top of my head as things where you cannot socially distance consistently at 6 feet throughout. And so those would not be allowed. However, the strength and conditioning and drills related to those sports could occur under the circumstances we already discussed, with social distancing and in cohorts and ideally outdoors. Unless fully distanced and outdoors, everyone wears facial coverings. They also note in the guidance that high exertion activities should be done unmasked and should be outdoors. So if you're going to do a high exertion activity, it's outdoors, and then you distance 6 feet and you don't need to wear a facial covering. Milder exertion can be done indoors using a facial covering. And then the final note I would say is that there really are no competitions allowed. Nothing that brings together even teams within a school, within a community, or travel from other teams is not allowed at this time. So people can, again, take a look. If they need clarification and such, we'll have that set up to be able to help them very soon.
Thank you.
Mm-hmm.
Cases of COVID-19 appear to be increasing quickly in Hoopa. Are those cases part of county data, and what is being done to help the Hoopa community slow the spread of the virus?
So Hoopa has been announcing some additional cases, and we've been in conversation with those. We work very closely with Hoopa. We actually take a lead on contact investigations and work cooperatively with them on those investigations locally. So we all communicate quite readily on this. Those cases actually do become part of our county data. They don't always become part of our data on the same day that those test results are available to Hoopa, because we actually need to receive copies of those test results and vet those, et cetera, before they become part of our case count. But ultimately, every resident of Humboldt County ends up counted in our numbers once for their positive case.
Thank you. Do the total county numbers include numbers from the Hoopa Valley Tribe, or are those numbers recorded separately from the county's data?
Again, as we just mentioned, they are included in our data for our county. So again, our timing isn't exactly the same, but it does get included in our numbers as well.
Given your knowledge of what constitutes a safe learning environment that reduces the spread of COVID-19, do you believe school districts have the space and staff to maintain a sanitary place for in-person instruction?
Well, again, I don't pretend to know the layout for all of the schools, their specific staffing issues, or even what their community is looking for right now. I think what public health has done is we provided a framework for schools based on the California Department of Public Health guidance on school return and the Academy of Pediatrics return to school guidance, among others. So we provided a general guidance for them as well as a template for them to construct a plan to incorporate all of those safety features that have been recommended. So I think what happens at each individual school will depend on what their local capacity is, what their facility looks like, what their staffing looks like, and again, the needs of their particular community, what the preferences are of those families in that community as well. So I'm sure the decision they make about which model they use will be based on a lot of those things and will reflect their capacity to adapt to COVID right now. I do think it's important to remind people, too, that whatever decision schools make right now is a decision at this point in time. So if they begin with distance learning because they don't feel they can meet these parameters or there are other concerns, then it does not mean that they cannot open later to on-person instruction. And by the same token, schools that begin with on-site instruction, if our situation on the ground changes here and means that it's more difficult to really keep those schools up and open, then they may need to pull back into distance learning during the school year. So it doesn't commit a school for the full length of the year. It really just gives them a place to begin to do instruction. And I think, as a pediatrician, I think learning in school is optimal for most children. And I think that we're facing a difficult situation here. I think if we can safely begin, it's nice to be able to do so in our community.
What is the health department's position on kids returning to school in person this month?
Well, as I pointed out, I'm a pediatrician, and so I really like to see kids in school. But we want to do that as safely as possible. I've had people ask the question about why do we say that social gatherings can happen, but we can put kids together in school. The answer to that is, again, there really is no wide society benefit or even huge immediate benefit to us gathering, for instance, 20 or 30 people for a backyard barbecue. But I think we would all argue that there is a huge societal benefit and a benefit to children and families if children are in school. And so that being the case, just as we look at our essential service workers in hospitals and in congregate living facilities and in agriculture and other places where we bring people together to work, we recognize that there is some risk whenever we bring people together. We construct plans to provide for safety as much as possible in those environments. And we recognize that transmission is occurring in our community in various settings. And that, I have no doubt that if we do operate in-person school, there will be cases of COVID in school. If we don't operate in-person school, we will still see cases of COVID in children and families and other members of our community. It's just part of our landscape going forward. So I want schools to be able to offer in-person learning if they're able to do so with safety guidelines, and it is a model that fits for them, their community, their teachers. And really, it has to be a joint effort from all of us. But I think we all recognize that school setting is optimal for most kids to learn and develop.
Mm-hmm. When should I seek emergency care if I think I might have COVID-19, but can't wait for a test and results to come back?
So again, if you are ever in a position where you are short of breath, having real difficulty breathing, your symptoms are severe, then you should go to an emergency room and seek care. If you have pretty significant symptoms, actually at this point, if you have symptoms consistent with COVID, we would really like you to contact your healthcare provider if you have one to talk about that and figure out if you might need testing. Or if you don't have a healthcare provider and don't have access to care, we'd like you to reach out to public health because through the JIC, ideally, because we want to try and get you tested and tested in a way that will get us results back more quickly so that we can address the issue. We prefer to use our Optum site because of the longer turnaround times for surveillance testing rather than for testing when people are ill right now.
Thank you.
Mm-hmm.
And from COVID-19, we passed through secondhand smoke.
So I think the underpinning of this question is really that if you are, it is not the smoke per se that is the issue, but obviously when people are exhaling and they're breathing out droplets and stuff, it's the same thing that we've been talking about, and the reason for distancing and masking is because we know those droplets can carry virus. And so, obviously if someone's smoking, they're not masked. If you're within 6 feet, you're too close. Of course, from a public health standpoint, I prefer no one is smoking. So we'll just put that out there. So I think it's just important for people to recognize that perhaps an indicator of having concern is if you're smelling smoke, if you're in a room with someone who's smoking, distancing, masking, and again, all those preventative measures. Ideally, people who are smoking should be doing so outdoor and away from others.
Thank you, and thank you for your time this afternoon.
Thank you.